and told you that they have COPD, right?
Mhm.
So I just gave you 2 indications to do a PFT. What are some of the indications that I gave you?
Doctor order?
Very good.
You said open heart surgery.
Uh-huh. So, that's a big one, right? Open heart surgery, and what else did I say about the patient?
COPD.
Okay, which is what type of disease?
Chronic? Or,
What was it?
Oh, what is that?
We learned on 2 different reasons why I would
obstructive?
obstructive disease, right? So he's having open heart surgery and he has COPD, right? Which is an obstructive disease, okay? Give me another reason why I would do a PFT. An indication. I keep looking at Ruby.
Diagnose. To diagnose.
Yeah, you can diagnose, or like if my patient already has COPD, what do I want to monitor on his COPD? What would the PFT be helpful? Yeah, so like, is their disease progressing? Is it degressing? You know, the medication he's taking, is it working?
The progression of the disease.
Yeah, the progression, or are they degressing, right? So maybe like major post-op surgery, I want to see how they're gonna do, right?
Before surgery.
Before surgery, especially major surgery, right? Do I need to figure out if he has restrictive, obstructive, or both, right? Are their medications working? So if I'm giving him a bronchodilator, an anticholinergic, a mucolytic, like, my PFTs will be able to tell me, right? So if somebody has COPD, what are some problems that you will see on my PFT results? What is a main issue with obstructive diseases? What is their one problem that they have problems with? What do they have problems getting out?
Volume.
Volume, volume, what else? What is the main thing, like from here to here, right? What is, your what? So remember, there's one thing that we have problems with obstructive. We have
Trapping air.
trapping air, okay? And then we have issues with flows, right? Remember, obstructive diseases have problems with flows because of issues in their airways. So what's going on in their airways, Amy, if they have issues with flows, obstructive patients? What is going on with my CBAVE patients, my chronic bronchitis, asthma, bronchiectasis, cystic fibrosis, right?
Their expiratory rate is higher, or will,
Their flows are compromised, but what exactly is going on in their airways? Not alveoli, airways.
Oh, airways.
What's going on with my asthma patients, my COPD patients, my cystic fibrosis patients?
Secretions.
Secretions, what else? That's causing an obstructive to flow. What happens with asthma patients?
The constriction, like bronchial constriction.
Which is like wheezes, right? That will impede flow. Asthma causes a lot of inflammation. So when you think of obstructive diseases, it's issues that impede flow, like secretions, bronchospasms, inflammation, right? And that's why our flows are very compromised and they trap air, okay? So we have to reverse the flow, right? And how are we gonna reverse the flow? And our PFTs are gonna tell us if they have issues with flows. You know, whatever I take in, can I take it out? Our PFTs will be the tell-all. So how do I reverse flows? So how do I help?
You have to identify first, that's why we're
Yeah.
doing PFT, to identify that.
If you've identified that they have issues with flows, right? Then they have an obstructive disease, what do we do? What can we do to help them?
Medication.
Like
Bronchodilator.
a steroid, right? A bronchodilator. What if they have tons of secretions? Mucus, right? And what did you guys do over there? Yeah. So our job is to help increase their flows with whatever the underlying problem is, okay? So I want you guys to start thinking about that, okay? So obstructive is issues with flows, and we know obstructive problems that can impede flows like wheezes, secretions, inflammation, which are our CBAVE diseases, okay? Now what's restrictive? What is restrictive problems? What can cause restrictive issues in my lungs? Bronchitis is an obstructive, okay? Remember, CBAVE is obstructive. Anything else, right? So think of a restrictive disease. We talked about this last week.
Emphysema.
Emphysema is obstructive.
And pneumothorax, what is that?
A pneumothorax, right, will
Hey,
restrict your lung. What else? could cause? Atelectasis, right? What if I have tons of fluid in my lungs? That's gonna cause restrictive. What if I have a pneumonia?
Yeah.
So everything else is restrictive. So how are you going to fix a restrictive disease? What do you have to do? Figure out the underlying problem and fix it. So if I, Emmanuel, you said pneumonia, how do I fix the pneumonia? Antibiotics, right? If I have fluid in my lungs, I remove the fluid. If they have a pneumothorax, I treat the pneumothorax, right? And so forth, okay? All right, so we figured out, so I gave you guys a patient who has COPD and who's gonna have open heart surgery. And so the doctor's like, we need to do a PFT because he's gonna have major heart surgery and we need to figure out what their baseline PFT is, okay? What do you wanna tell your patient before they do the PFT? Anything you wanna tell them? Don't drink coffee, what else?
Avoid,
Smoking.
Smoking. Yeah.
Gases.
Cold.
Yeah, cold, and then, don't, maybe not take your medication so I can get a good baseline of what you have, okay? All right, Ruby, do you wanna help me with my PFT? So now that we have all that situated, and Ruby's gonna do our, she's gonna plug in all of our numbers for our patient, and that's gonna give us our predicted, right? Because we all have a predicted percentage for our PFTs based off of our lifestyle, our demographics, all that stuff, okay? And remember, what do I need to do before I actually use my PFT? What is it called?
Calibrate.
And that calibration is important because it tells us, it gives us a normal percent of error you can have, okay? And it should be less than 3%. If it's greater than 3%, then our results are gonna be, okay? All right, so this is a really old PFT machine, but this is a flow sensor. Here's my PFT. Here's my 3-liter syringe that I'm always gonna use to calibrate. So on your board exam, they'll say, Diana, you need to calibrate your PFT machine. What are you gonna use? 3 liters. Okay, it literally is.
I need a respiratory therapist.
3 liters. Diana. Okay. So Ruby's gonna calibrate this. Okay. So here's my flow sensor, which would be my mouthpiece. Okay, attach this to your flow sensor. Okay. And then the mouthpiece is gonna be like our patient, right? She's gonna attach it to my syringe over here. And go ahead and do number 5 cal check. And it's not touch screen because you guys are so young and and you have to put the number of the flow sensor. So just put your number. Okay. Okay, and it says attach sensor to syringe and pull plunger out when it's done and hit proceed. Right? And it's zeroing in progress, so don't touch it. Okay, now push plunger smoothly over 2 seconds. So literally 2 seconds. 1 1,000, 2 1,000. Okay, and then for inspiratory, go ahead and pull it out. Okay, and then I think it gave it to us, right? Yeah, I think it was like, what's this again? It was really fast. It did. Zeroing. Okay, go ahead and push it in. Okay, go ahead. Yeah, so here's your inhale and exhale. So that's a good difference, okay? Okay, so we've already done our cal check. It's less than 3%, okay, so we can trust it. So now what you're gonna do is you're gonna add all of your patient's information to get our predicted value. So go ahead and do new. So she's gonna do new patient, which is 1. Okay, and then hit yes. All right, so these are all the questions that you as a therapist are gonna ask your patient. So you're gonna enter the MRN number, right? So you can put like 1, 2, 3, 4, 5. And then we can go down the line and ask all your classmates these questions, and you guys can give her makeup stuff, okay? Okay, I need a name.
Anna.
Anna, okay. You guys can make Anna a smoker, I don't know.
Like old school.
Very old school, yeah. And you don't have, you can just put like a.
Okay, I need a height.
And you have to enter it in inches, so 5'4" is, how many, so you have to know it in inches, so 64,
64.
yeah, okay? Yeah, I think you have to do it in inches, 64. Okay.
And then birthday?
Birthday, how old do we want Miss Anna to be?
65.
65, okay. I don't know.
She's old.
January 27th, 1955. Gender, she's female.
Female.
Race? What race is she?
African American, Asian, Caucasian, Hispanic, or other.
Other. Do the other.
This is a class. What is that?
I think that's the percent,
I need a weight.
140 pounds. 140? Okay.
And then you're smoked?
Do they smoke?
Do they smoke?
Yes. 10 years.
10 years, okay.
How many cigarettes a day?
I don't know how many come in there. I don't know.
I don't know either. 24.
I don't know. I'm just assuming.
Okay.
Dang, do people
Years
really
quit if
smoke
They quit.
Oh, the heck yeah.
Okay.
And you can put like comments like, patient only speaks Spanish, or, you know, patient told me that they did not take anything that you guys told this morning. And you have to put physician, physician and all that stuff. Okay, so based on that, it's gonna give us our predictive for our patient, okay? So now we can do tests of tooth, okay? And then that's when we're gonna use our mouthpiece and explain to them how to do the maneuvers, okay? So if I'm gonna do a forced vital capacity, how would I explain to my patient? So Ruby's your RT, okay? And that's the mouthpiece, and here is really old school nose clips that you're gonna put on them. How would you explain to your patient how to do a forced vital capacity?
So we're gonna put the nose clip on you, and you're gonna breathe out as fast as you can.
Okay, as fast as, so take a big deep breath in, and make a nice tight seal on that mouthpiece, and you're gonna breathe out as forcefully as you can, okay? So,
And breathe out
as forcefully as you can, okay? Just force it all out and fast, okay? All right, so that's how we do a forced vital capacity. Okay, any questions on forced vital capacity? No? So now let's figure out their,
Is there like, wait,
go ahead. And it, right here, like it tells you right here, like this is a forced vital capacity. So you'll do this, and then you have to put your, right?
So double up, everybody know what double is?
Okay, so this is when like you would start your test and you have a better test. Should have done that. That was like my little frustrator. Okay, but you would tell them, and this would give you like your actual results, okay? All right, so any questions on that?
yeah,
Okay.
so, the first vital, that is connected to that one,
Yeah, it's only connected to this to calibrate it.
to calibrate it.
And once you've calibrated it and you've got, and so my first, PFT was my vital capacity, my first vital capacity, right? What should my patient get? What's a normal forced vital capacity? Do you guys remember? What is like a normal percentage predicted?
Um,
Anything 70,
Whoa,
70%.
this one is 80%, right?
Oh, okay, the other one's
So you want it to be greater or equal to 80%, okay? And remember, this one is very helpful to determine if my patient has restrictive disease, okay? So, my predicted, and that's gonna be our result.
So if it's less, then it would be restricted, it could indicate the restrictedness.
Okay, so my predicted PFT is what my patient should be getting, right? And when we did the forced vital capacity, they got 2.25, okay? So now what you have to do to get your percent is you have to divide your actual over your predicted, right? So 2.25 divided by 4. What did I get? You divide your actual, so what they actually got over your predicted to get your percentage, okay? So what's my percentage? Who has a calculator? 56%? Okay, so they got 56%, so 56% forced vital capacity, right? We want it to be greater than 80%, okay? So that means that they're a little, they're pretty low, right? Okay. So that pretty much tells us that they do have some type of restrictive going on, okay? Because it's not 80% of their predicted, all right? And the beautiful thing is that this machine will give you all of those numbers. It's just knowing where to find them and how to look for them. But I think it's easier that you guys understand how to calculate them so you know what you're looking for. Because when I first started doing PFTs, I was like, what the heck am I looking at? I don't understand this, you know, it's like, you know, but this will, all your printout will give you everything, okay? All right, so any questions on the forced vital capacity for this little lady? What was her name, Anna? Anna? Okay, so now we're gonna do an FEV1, okay? So how am I going to explain to my patient how to do an FEV1? How would I tell my patient how to do an FEV1? So you're gonna take a maximal inhalation, right? Take a big deep breath in, and then you're gonna blow out all that air until you can't no more, okay? And this little machine right here will tell you when to tell your patient to stop. So big deep breath in, and then just blow out until you've hit your residual, until you've pretty much blown out all the air. So you wanna get that breath over a certain amount of time, so not forcefully, it's just big deep breath in, and you're just go, keep going, keep going, keep going, keep going, keep going, keep going, and that will tell you like, perfect, we got enough air out, and now we can measure it, okay? All right, so their FEV1, their predicted was 3.5, and they actually did 3.16, okay? So, now I need to get what my percentage is, and this one should be so this one tells us about obstructive, this one tells us about restrictive, okay? And then remember, I also need my ratio. Very good to classify if we have obstructive. And this one should be 70% too. Okay. All right, so what's my FEV1? 90%? Okay, and then my ratio, do you guys remember how to calculate your ratio? You get your actual FEV1, right, which was it's like 100, probably something, huh? 140, okay. So what is my patient's main problem, an obstructive or restrictive disease?
Restrictive.
Restrictive. Because these two numbers
Oh, I see.
are greater than 70%, so I can rule out obstructive. And this number is less than 80%, so they just have restrictive. Okay?
140%?
So you're supposed to get at least 70%. They did really well, they got 140%. So there's no obstructive because it's greater than 70%. Okay? So we can assume that they have whatever the restrictive disorder is. Okay? You want another example?
Yeah.
Okay. Okay, so we're gonna do another patient, okay? And this patient only has one lung. No, I'm sorry. Cystic fibrosis, a very old cystic fibrosis patient, okay?
Old cystic fibrosis.
Old CF patient, okay? Okay, so what's my forced vital capacity? You guys know?
93%. You have to divide it.
93%?
Yeah.
Okay. And what's my FEV1?
Now, you see this syringe, this is the Nancy one. So, I would ask.
53.
Okay, and what is my ratio? So my actual FEV1, my actual. 80? Okay. Okay, so do I have any restrictive disease?
Mm-mm.
Because it's greater than 80, right? So I can rule out restrictive. My FEV1 really does tell us about obstructive, it's 53%. And this really is my tell-all right here, so.
What?
The ratio for obstructive, okay?
Oh, that's like your final say.
Yeah, okay?
So, now, yeah, those other percentages like say something, but at the
This one's
end is what you
53%.
decide.
Yeah, this one
That's your
really does
final.
tell us, okay?
So that is restrictive. No?
So this is the only thing we look at for restrictive, okay? And it's greater than 80%, or 91%, right? So if it's greater than 80%, I don't have restrictive.
No? Oh. You want it to be, if it's, so it's lower, then it's restrictive?
Yeah, you can say there's some restrictive, okay? These two are for obstructive, but this one really is my tell-all for obstructive. And it's 80%, right?
Yeah.
So if it's greater than 70, this can really exclude obstructive. Can they have some obstructive? Maybe, but we really need to look at this. Okay? Now, if this was, I don't know, 60%, right? Then it's definitely obstructive. Okay? Because it's less than 70. Right?
And then if the top number was less than 80, then it would be both.
It'd be both, yeah.
Okay.
You have a combined restrictive and obstructive disorder. Okay?
The one for 80 earlier was restrictive, right?
Mm-hmm.
Yes. Uh-huh. That first one was only restrictive because my obstructive was greater than 70%. So if it was 60%, let's say, oh yeah. Awesome. Now let's plug in, okay, so if my actual changed to 1.5 and I divided by my predicted, it's 36%. And then I got my actual answer 1.5 over my actual at 3, that's 54%. So now you can say what? What can you say about your patient?
That it's an obstructive, not a
That it's
restrictive.
an obstructive, right? Because these two numbers are less than 70% of the predicted. I want it to be 70% or greater. So what does that tell you about their flows? Airways.
It's trapped.
They're trapping air, right? And you gotta figure out, and I told you my patient has, what did I say?
One lung.
Oh no, cystic fibrosis.
Oh, cystic fibrosis. Oh, you said one leg first, huh?
Cystic fibrosis, so if they have cystic fibrosis, then you can kind of put two and two together and they have secretions, probably bronchospasms, so I'm gonna help them with that flow that's not coming out, right?
Mm.
Did I say FPV had 1.5?
Yeah, 1.5.
Okay. So you're good.
This is super, who's like, has anybody completely lost or you're just like, I know what I'm doing?
No more.
I'm just plugging in numbers, I don't know. Not no more?
You did a good job.
So, if it's obstructive, remember it's our C-base, right? C-base. Cystic fibrosis. Bronchitis. Bronchiectasis. Emphysema. Everything else is restrictive, right? So if I have one lung, yeah. Okay. So everybody take a peak flow meter. Okay. And if you guys have a little pamphlet, get your little pamphlet out. Okay? And everybody, so when would I use a peak flow meter? When would I use one of these? A peak flow meter. For asthma? For asthma, right? So I can monitor my flows like instantly, right? So everybody get their little pamphlet if you have one and figure out what your normal peak flow is. And there's a little box there that has, based off your gender, age, and height, okay? So everybody know their normal
height, age and height, right?
Yeah.
Once they're done with the pamphlet, I'll give you.
So the
Peak flow is measured, it's good for, to measuring your.
Okay, so it's children, males, females. So we look right here, look at our age, and then our height. And then we find our, what we should be doing. 40.
All right, so let me give you a scenario. You have a patient who, you're working in the emergency department, okay? And it's real busy, it's flu season, it's cold, then you get called and you say, and then they tell you you have a stacked asthmatic patient coming in, and EMS already gave him a dose of albuterol. The doctor's like, let's start him on 10 milligrams of albuterol when he gets here with Atrovent. And I want you to do peak flows before and after their treatment, okay? All right, so what's your normal, Diana? Peak flow. Did you get yours?
This one is the same one. So
You look at the female. And then you find your age. And then how tall you are.
I don't know how to compare this. 35 or 40.
What's your height?
Height is 5'5".
5'5", so you're 64, 65?
So 480.
480, okay. And what's yours, Natalie?
It was like 483.
483?
Yeah, 483.
Okay. And what's yours?
480.
So
So mine is all the way over here.
Have a look at gender, height, and age.
So mine is all the way 488.
Yeah. And then you increase it to. So you put the green to the go, yeah. And then this is where you're at, and then so
What's your normal reading? Yours is probably high because you're tall. Ooh, okay. What about yours, girl? 485? Okay, so you guys are about 480s, okay? So right now, you should be able to get the 480s because you have no obstructive, right? Unless you guys are wheezy, coughing, you know, something going on in your airways or secretions. But you should be able to take a deep breath in and blow it all out. And that little red indicator should go to, you want it to go as high as possible, right? As close as yours. And see those little other indicators that are color-coded? You put the green on their normal. So you tell your patient, your normal is 480. I'm going to put that little green indicator to your normal, okay? Oh. And the yellow and the red, I let them know that anything half of their predicted is severe, okay? So I put the red on what their half of their predicted is, right? So if you're 480, you let them
Then you
know
should
half
be
of your
doing
predicted is 240. So that means, what does that tell you about the airways? What's going on with the airways if you can't get your predicted? They're closed. They're closed, right? You can't exhale that air out because your airways are closed. Okay? All right, so you just tell them, if you get anything less than half of your predicted,
So
you
you
should
put
probably go
this
to your
in
doctor.
where it's at?
Or they're going to be really short
Where
of breath.
This
Every-
one half.
half of what it is, yeah.
All right, so we just gave them, they came in, we told them to do the peak flow, nice big deep breath in and out, and blow it hard and fast. And they get 260, okay? So that's their before, right? Hoping they open up, right? And then, what's my unit dose for albuterol? 2.5 milligrams? So how many little packets of albuterol am I gonna give them to equal 10? 4. So you're gonna open up 4 and put it in there, and open up 4 and put it in there, okay?
What is that? Is that a TX?
Yeah, so it's treatment.
Oh, okay, I didn't know.
All right, so they've done their albuterol, 10 milligrams, okay? And the doctor wants you to do a peak flow afterwards to determine what? If the treatment worked, right? And if I open up my airways. So let's say they got 340. But a good thing or a bad thing? Good. Good. Okay. My flows increased about how much? Almost 180, right? But are they still where I want them to be? No. So what do you want to keep doing?
Give them more.
Give them albuterol so you can tell your doctor, you know, they went up about 80. That's what you want to give them, right? They go, you know, they went up at least 80 ml. Okay, well, they're opening up. Maybe we should schedule these every 4 hours. Sounds good. Let's keep them on the schedule every 4 hours. Okay? And then once they reach their predicted, we open them up. Maybe we can change them to PRN every 6 hours. Okay? Or every 8 hours.
So you give them the albuterol until they reach the predicted?
Yeah, until you open them up completely. Now, once you open them up completely, then it's just maintenance and maintaining them and watching them.
How come we would do something like that, like continuous treatments every, Q every whatever, versus something like just going straight for like the hour long or?
Yeah, you can do the hour long.
Is it
Yeah.
just practice?
Yeah, I mean, you can just do like, can I I do another 10 milligrams of albuterol. But you want to look at like, how's your heart rate? Sometimes patients are like really shaky and you're like, let's open them up a little bit. Obviously, you're going to look at the patient's heart rate breathing too.
It's basically just like assessing how they're handling the treatment.
Exactly.
How they're-
That is key. Because if they're, let's say they're really jittery and they're just like, I can't do another 10 milligrams. Okay, well, let's just do it every
Yeah, spaced out or do smaller.
They're like, puffing and puffing, like, oh no, you need it now. Let's do another 10 milligrams. Sometimes they're so bad that you use 20 milligrams, 15 milligrams, you know? And, sometimes they don't open up like that. Gotta reassess it. All right, any questions with people? Yeah, so basically, you really do use these like any, like people who are at home who have asthma. We give them one to take home and tell them, hey, just monitor your peak flow at home to see how you're doing. Especially if you're taking like maintenance drugs. We use this a lot in the emergency department. What was it?
Oh, that one in
If they're really short of breath.
Oh, wait.
Like if
I
somebody
think
comes
so.
in and they can't
Did you have another one?
they can't do this, and you would find it.
Oh.
They're really having trouble breathing. You're not gonna say, hey, do a peak flow, and they're just like, you know, I can do a peak flow. Open me up first, and then I'll do it. Right?